Hi, I'm Dr. Ashley DeLeon. I am a board-certified general surgeon and trauma surgeon and fellowship-trained transgender surgeon practicing at the Crane Center for Transgender Surgery. We are a group of surgeons, of several surgeons with multiple locations in the U.S. who provide surgical options from head to toe for trans men, trans women, and non-binary gender fluid individuals. Our collective backgrounds encompass plastic surgery, urology, reconstructive urology, general and colorectal surgery, craniofacial surgery, microsurgery, and gynecology. And we've all quit our day jobs, so to speak, and have dedicated our careers to the trans community. We perform gender-affirming surgeries for patients that come to us from all over the world and are proud to say we provide both comprehensive and compassionate transgender surgical care. So today we are going to be discussing how we approach the insurance companies to get your medically necessary procedures covered, and specifically we'll be discussing this in regards to tracheal shave. So we have come a long way since Dr. Crane first started the practice back in 2012, when we only had about 10 to 15% of our patients that were covered by insurance. And so the majority of our patients were having to bear the financial burden of their procedure completely alone. So Dr. Crane not only pioneered and perfected a lot of the operations that we do today, but he was also one of the first transgender surgeons to say, we're willing to work with any insurance company. So since that time, through a lot of hard work on our part and on yours, battling trans exclusion policies, which fortunately are now illegal, and also persuading politicians to do the right thing for the trans community, we're now proud to say that 85 to 90% of our cases are insurance-based. So this is incredible considering where we started. So what I want to share with you today is what goes on behind the scenes with the insurance companies and our practice during the authorization process. So this involves personally advocating for you, with our ultimate goal being the insurance company approving your medically necessary procedure and your entire procedure. At the Crane Center for Transgender Surgery, we have an entire team of experts in billing and insurance that we specifically employ to help us get your medically necessary procedures approved. So this team, how it starts, this team typically will submit a list of codes, these are called CPT codes, to your insurance company for approval that encompass the various procedures that we plan on performing during your surgery. Once the insurance receives these codes, they can either approve all of them, none of them, or only part of them. So should any of the codes for your procedure get denied, the next step is to submit an appeal on your behalf. So part of this process often involves a peer-to-peer call between your gender affirmation surgeon, such as myself, and a physician who is employed by the insurance company. So typically, this insurance company physician is a primary care physician of some sort, and thus may not understand all the nuances of surgery, especially gender-affirming procedures, but they are knowledgeable about medicine in general. So it's then our job as your surgeon to have an educated discussion with them and help them understand why your procedure is medically necessary and thus why it should be covered. So let's talk about trach shave, which is also called thyroid cartilage reduction or chondrolaryngoplasty. We often get denials for this procedure, as insurance companies state that the company views it as cosmetic. So let's look at some background information first. So a cosmetic procedure is something that's already considered, when something's already considered normal, is enhanced surgically. So for example, if I, as a cis female, wanted to have breast implants placed to make them larger or to enhance them or to augment them, this would be considered cosmetic, since I am enhancing an already normal structure. A reconstructive procedure, on the other hand, is when we take something that's considered abnormal and we reconstruct it to make it normal. So for example, a cis female with breast cancer who has had their breast removed by mastectomy to treat her cancer no longer has breasts, which is abnormal, right? So therefore, to place implants in a breast cancer patient is considered reconstructive, not cosmetic. So keeping that in mind, when I'm doing a peer-to-peer review with the insurance company's physician to appeal a denial for Tracheal Shave, I utilize this information then to build a compelling argument and hopefully overturn their denial. And using the case of reconstructed breasts for cancer patients is a great example to help them understand the differences and similarities, as breast reconstruction in this setting is always covered by the insurance companies, as it should be. But we want them to understand why it shouldn't be looked at any differently with Tracheal Shave. And then it allows us to discuss the differences between cosmetic and reconstructive procedures. So first, let's look at what the thyroid cartilage or Adam's apple is. So everyone has a thyroid cartilage. It's where the vocal cords are housed, and it's also contiguous with your trachea, or in other words, your windpipe. Now, although everyone is born with a thyroid cartilage, it is only during puberty that it differentiates itself between males and females. So during male puberty, testosterone production goes up significantly. The thyroid cartilage has testosterone receptors on it. Thus, when it becomes exposed to these very high levels of testosterone, it enlarges significantly. In females, when they hit puberty, on the other hand, they're flooded with female hormones like estrogen and progesterone, which does not alter the thyroid cartilage. So therefore, after puberty, males are going to have a prominent thyroid cartilage or Adam's apple, whereas females are not. So the Adam's apple is thus what we call a secondary sexual characteristic that differentiates males from females, okay? So I always ask, first, I always ask, do you consider it normal for a male to have a large, prominent Adam's apple? And no one can deny the answer is yes, a male should have a prominent Adam's apple. I then point out, if they agree it's normal for a male to have a prominent thyroid cartilage, then they must also agree that the converse is true. It would be considered abnormal for a female to have a prominent Adam's apple who wasn't exposed to testosterone at puberty. So if it's abnormal for a trans woman to have a prominent thyroid cartilage, since this is a decidedly male secondary sexual characteristic, when doing a tracheal shave or a thyroid cartilage reduction or chondrolaryngoplasty, we are, by definition, taking something that is abnormal and making it appear normal again. Does that sound familiar? It should. It's the exact definition of what classifies as a reconstructive procedure. So tracheal shave is not a cosmetic procedure. It's a medically necessary reconstructive procedure to provide mind and body gender congruence and help alleviate gender dysphoria. So by discussing this in the context of other operations they do cover, example, breast reconstruction for cancer patients, it's then easy to see why their policy is inconsistent. So, in denying a transgender patient's trach shave is therefore discriminatory in nature. And then in addition, I often point out that not only is trach shave reconstructive, it's a male feature that is very difficult to disguise in a trans woman. It's on their neck. So other than committing to wearing scarves for the rest of your life, which good luck in Texas, it's impossible to disguise. So therefore, it makes sense why a prominent male thyroid cartilage would specifically cause worsening of gender dysphoria. And if there's a lot of resistance to the change, then I also like to highlight that denying tracheal shave is not only discriminatory, but it also can be dangerous for the patient. Forcing a trans woman to walk around with a male secondary sexual characteristic for all to see, such as a large Adam's apple, especially a feature they're unable to hide easily, it can make it obvious to others that they're transgender. And that puts patients at risk to become victims of discrimination and hate crimes. So as world-renowned experts in gender affirmation surgery, we think it's important to also help keep transgender patients safe in a discriminatory society, which is why with the tracheal shave, we find it medically necessary as a reconstructive procedure to help treat gender dysphoria and achieve gender congruence. And so thus it should be approved by your insurance company. It should not be deemed cosmetic. So now again, this does not guarantee they're going to approve the appeal and cover your surgery. But it does provide them with a compelling argument and gives us a good chance at getting it covered and getting it overturned or getting the denial overturned. And if not, if they say they're unable, to cover the procedure since it's not in their policy, then we typically ask that they kind of bump it up the chain, go talk to your superiors. It is the physician, the insurance company's physician, it's their job to utilize their medical knowledge to function as a medical liaison between us and the insurance company in order to affect policy change for their company. And this is in order to ensure that they're approving medically necessary procedures for their beneficiaries in a non-discriminatory manner. So the onus is on them now to do the right thing. So it doesn't always work out, but we do have a lot of success by approaching it in this manner, and we're happy to advocate for our patients, and we do so routinely. So thank you so much for listening today. I hope this was informative. If y'all have any additional questions, feel free to visit our website at www.cranects.com and reach out to our office. And also don't forget, the more proactive you are with your insurance company, the more success we're gonna have actually fighting for you to get that appeal overturned and get your procedure covered.